Materia Medica 360 degrees. Welcome back to the channel, and today we will do two remedies. First we will discuss Aurum Mur, a very important remedy, followed by another salt to it is Aurum Mur Natronatum, excellent remedy for fibroids and growth like that. So we will do both the remedies. So let's quickly start with Aurum Mur. Aurum Mur is actually considered one of the most romantic remedies of our Materia Medica. What does it mean? Romantic people means very passionate people. So when we see the cases, we will see that they have been passionately in love for one person, they are committed to one person, they are religiously in love with one person. So when we have such a character, we would often think of Natrum Mur, where eventually he will be disappointed also, because being committed in love gives you disappointment also. But the difference there is that Aurum Mur people are also passionately sexually attached as well, whereas Natrum Mur is not. So sexually attached is only Aurum Mur, not Natrum Mur. Now, of course, I told you that they are passionate people, so the disappointment comes, and the disappointment in love is where they will be mentally, physically, financially, emotionally traumatized, and in fact they will be insulted, and this will affect them personally a lot. Now these people generally need love and sex, so they want both kind of relationships. Often you will see that they have a habit of masturbation or erotic life, which if not fulfilled will turn into anger or anxiety, and even patient will be taking medicines for hypertension or some renal complaint or some liver complaint or some heart complaint. So you have to really take the timeline of that whole pathology. So from this we understand that Aurum Mur is a combination of syphilitic and tubercular miasm. Okay. Now these people have a fear of disease. They will have a lot of worry about their health, but they will not tell anybody. So they actually avoid telling their anxieties to others. They will develop palpitations and worries and anxiety and nervousness, telling it to even a doctor. And they have to avoid telling the anxiety which is felt at heart. So in the heart region they will be feeling this anxiety and palpitation, especially night. So this modality is very key point. And cases where there is a history of suppressed eruptions or warts on genital areas. So a lot of cases come where genital warts have been treated locally or surgically, they have been removed. They can end up having some symptoms which can point out to Aurum Mur. Eventually what happens is that earlier they were very passionate, become low in libido, and they want to commit suicide. So such is a state, such is a change where the patient needs treatment, and whenever the disappointment comes, they will be very, very unhappy. So unhappiness from breakups, very common these days, can be very well tackled by Aurum Mur. Because they are very passionate for one person, they will never form another relationship. You can think of this remedy in widowers, widow people, males having prostate troubles, hypertension, insomnia, or bone pain, especially in the night time, or asthma, midnight time, or sinusitis with symptoms in the later part of the evening. And there in sinusitis, consider the discharge will be yellowish and burning associated. So some kind of a burning sensation which is aggravated by heat and relaxed by cold application. Also, bending forward is problem for the patient in asthma. So what happens eventually, the people after getting disappointed starts consuming alcohol, and they can develop a habit of it, or they can start having anxiety attacks where they walk a lot. So a lot of walking. So this is something we can carry on and see what happens in a case of another salt of it, which is aurum mur nat. Now you will see aurum mur is not essentially but more often seen in males, whereas aurum mur nat is more often seen in females. So very often female cases require aurum mur nat, where the reports or ultrasound can show enlarged bulky uterus or retroverted uterus, large fibroids after all the mental agony. In fact, cases of sterility where because of such large size fibroids the patient cannot conceive, or the patient ends up having frequent miscarriages. So she is advised to go for surgeries and the patient is worried for such surgeries. You can start with aurum mur nat. In fact, besides this female reproductive system, you can think of aurum mur nat in cases of liver cirrhosis, in cases of renal pathologies, in cases of very tenacious stubborn piles, or urinary complaints which are related to or because of uterine pathologies. Now, what is the sensation? What will patient will actually tell you? There is heaviness, bhari bhari lagta hai. So there is a lot of heaviness in aurum mur nat patients. The lower abdominal region, patients can have indurated ovaries, so hard ovaries, maybe pathologies which have been started as PCOS ending up in indurated ovaries, finally giving rise to sterility in females. You can think of that, where patient can have leukorrhea also, and patient can have amenorrhea also. So all these cases can be very well taken care of by aurum mur nat. Usually when the case comes to you, the female will be very mature female, very admired female. She will tell you that she fell in love with someone and there was a whole romantic story behind it, and there was a deep sexual attraction also, but only with that one person. She in fact developed nymphomania to that one person, and then with that single partner there was this disappointment. Now what happens after the disappointment? This female is hurt, and the hurt, as I told you, which is common in aurum mur, is hurt at many levels: mental, physical, emotional, at all levels she is hurt. Now because she cannot have that person, she will develop this very bad indifference, and that changes a lot. So this person will patient will change a lot. The patient will tell you कि मैं इस event के बाद बहुत बदल गई, and they will have no interest in any form of sexual activity, and there will be a lot of anxiety. Very key point of aurum mule. So this indifference in physical form will develop in the form of induration of ovaries or uterus or fibroids or breast, anything. And in fact, the patient can also develop suicidal thoughts, all right, and they can have menstrual complaints. It can be a premature menstrual cycle or completely amenorrhea. And often at physical level they can develop gouty symptoms where there are nightly bone pains, because the patient is mainly syphilitic. Nightly bone pains which are worse from any kind of exposure to cold air. Since the patient is syphilitic, they will not give you whole detail of the symptom. This is a problem. We need to be very tactful, and there will be a dragging down sensation from the chest to the uterus. And what really attracts the therapeutics here is that the main organ will almost always be uterus, where there are big fibroids, where the fibroids are so big that they will put pressure on the bladder, and the patient will have urinary symptoms eventually. I hope this helps. Thank you very much. Subscribe the channel, share with the community, and I am coming up with more such details, basic keynotes that will help any clinician, any practitioner, any homeopath to really find out the remedies and apply. Thank you very much.